Hello and welcome. About a week or so ago, I got a crick in my neck. It was unpleasant, but I thought, hey, I could make a video about things that I do to help get rid of the crick. I know a lot of us get them, unfortunately. Usually symptoms are pain in the neck, usually with certain movements like rotation, turning your head, tilting your head, things like that. It can come up in other ways too, but those are some of the main ones I've experienced anyway. And the first thing to do when you get a crick in your neck is don't freak out. Fear and worry and anxiety are pain food. So as many things as we can do to soothe our nervous system, soothe the freak out part of our brains, and get back to moving as much as possible. Those are the things that tend to be helpful when we get the crick in the neck. Sometimes there's some strategies and things that I think are really helpful, and that's what I'm going to show you today is just a few things that I do. Something to know is that it could take several days. It can take more than a week for a crick to fully resolve, and that's normal. It should get better and better as the days go on, especially after the first couple of days. It should start to improve steadily, but it's going to take some time to fully resolve. And so that's something to be expected. When your neck doesn't like to move, we try to move other things. Sometimes it's actually really helpful to just go out, go for a walk. Something like that can be really helpful. But more specifically, we might, if my head doesn't want to move, maybe I'm going to move some of the things around my head. And really that's shoulders and other parts of your spine. So for instance, a lot of times when I get a crick in my neck, I'm going to do scapular work, meaning my shoulder blades are moving, my shoulders are moving, my arms are moving. My neck doesn't necessarily have to move, but I'm still going to be communicating with all the tissues and some of the like spasm muscles that are there. So I'm going to go up and down. Now, what I like to do is really try and breathe in and breathe out. When we start to elongate and slow down your breath, that communicates to your nervous system, hey, things are okay, I'm safe, I don't need to panic. So I'm going to breathe in and out. Or I'll switch it up. Breathe in with my shoulders down and breathe out as I lift my shoulders up. It doesn't have to be specific. It's just coordinating movement and breath a little bit here. And when I go down, I might actually kind of press my shoulders down and then come up. And I'm really trying to move like my shoulder blade. I'm not trying to turtle my head, if that makes sense. So turtling your head, especially if you got a crick in your neck, probably isn't going to feel good, but lifting your shoulder blades, it still may not feel good, but it's not going to necessarily be as crunchy on the neck, and it's going to be really good for your shoulder blades, so why not? The other thing we can do is start to turn our body and keep your head still. So if I turn my body, now you don't have to be sitting on the floor like me, should have said this earlier. You can be sitting in a chair on the edge of your bed, standing up, doesn't matter. But if I turn my body and I keep my head straight, now technically I'm turning my head, but sometimes this little trick can allow me to turn my head when actively turning my head from straight doesn't work. So I might go to the side that doesn't hurt, take a breath there, let my brain feel how that feels, and then go to the side that does hurt. And I might go here to what I call the ick zone. So if you start to do this and you kind of go, ugh, it's tolerable, but it's not nice. I call that the ick zone. And when you get into that zone, try not to immediately come out. See if you can go to that ick zone, pause, take a breath in and out. And just tell yourself, this is a normal way to move my head. Come back to center. And then you can try it again. You can kind of go the way that feels okay, feel the way that feels less okay, pause in the ick zone. You can even try and do like a little shoulder wiggle there, anything to just kind of see what your neck will tolerate there. Take a breath in and out, soothe yourself, come out. So in that way, we're kind of moving our shoulder blades in a different way and twisting the spine. You're actually rotating your neck. Sometimes the sneaky way will actually allow you to go further than you expected. Okay. Another thing you can do is lift your shoulder. So a lot of times I'll do this on the side that doesn't hurt as much first so that my brain can feel what it should feel like. So I'll lift my shoulder up and then try to take my ear, the side of my head, toward my shoulder. And then take that down. And now I'm going to lift this shoulder up and then I'm going to give it a try and just see if I can almost like relax my neck and the side of my face toward my shoulder. Now, you might get into the ick zone really quick if side bending is a thing that is problematic for your neck, but it's something that you can try and just play with. And what I'm actually doing is when I lift my shoulder up, I'm thinking about like the low part of my neck going towards it and then the rest of it, almost like one vertebra at a time. And if I can get my head and shoulder together, not everybody can, it's quite a bit of motion, but I might kind of press. The other thing that you can do if you're like, Tiffany, you know, if you're like, your shoulder comes up to here, you can still try and see, all right, well, like, what can I do? Can I get my low neck closer to my shoulder? And then you just see how much of the rest of it you can lay down. You can even play with that, right? Like just that low neck, then the middle neck, then the upper neck. Sometimes that's a little bit of a brain teaser, but we're just trying to kind of convince our neck to let us move a little bit. And at first it might be more like slight movement, take a breath, go on from there, but things to work toward. The next thing we're going to do is just straight up range of motion in the neck. And the idea with this is to move slowly, use the ick zone concept to like stop it in any ick zones, maybe pause, take a breath there, keep going, and you just move through as though you expect your neck to move normally. And when it doesn't, you don't freak out. You breathe, you keep moving. So here we go. What we're going to do is try to, I'm going to make the best double chin I can by trying to take my chin toward the top of my sternum, or like my chin toward my throat. And then once I get that, I can imagine taking my forehead toward my chest. That's not going to be a lot of movement, but we're just doing that, and you roll out of that. And as you roll out, you can see I'm kind of, as I roll out from that really deep flexion of the neck, I'm going to try to roll out from the bottom up and then keep that movement going. And I just look up to whatever degree I can, and then I come back to the start. Okay, so that's going to be chin to throat to sternum, and then you imagine your forehead coming down some more. Roll out of it, and then you just look up to whatever degree you can, which might be a lot or barely any. Come back to center. Now, I'm going to try to take my chin to my left side collarbone. And I'm just going to do my best here. I might get to the ick zone. I might have to pause, breathe, back off a little bit. And then I'm going to look the exact opposite direction. So if my collarbone is here, then I'm going to be looking up and to the right. I'm going to do that again. Left collarbone. Look up and to the right. Now I would do the one, I would do the side that going to the collarbone doesn't hurt so much first, if that's a movement that hurts. But really we're going to be exploring both sides of the neck with these, because we're moving in these diagonals as well. So you can play with those 3 directions, and it might be that you start to come down here and it's just like, okay, I'm moving toward my collarbone, but like that's all I got. All right, and then I go up and like I'm gonna look with my eyes more than my actual head, but I'm gonna do my best, right? Don't freak out. Okay, Now, here's a couple of other things that you can do, a little more movement. This one you gotta get down on the floor for. Actually, you can put your hands on like a coffee table or something too. That would be absolutely fine. So sometimes putting ourselves in different relationships to gravity can be really helpful. And so I'm gonna be on all fours. This in itself might be an ick zone movement. If it is, you can kind of play with like shoulder blade positions. You might hold it and just breathe for a minute and then come out. But we might try doing a little cat-cow where your elbows stay straight, round your spine toward the ceiling and see if you can relax your neck. Sometimes that's really hard when you got a crick, but do your best there. And then you go the opposite way. Your belly comes down, but you pull your heart forward, stick your butt in the air. And then I think about looking forward by lifting the back of my skull, the back of my throat, the back of my neck forward. And then relax it back down. And then you're going to activate it to lift it up. So you can do a few rounds like this. And then you can try and go side to side, like you're doing a little side bend, trying to take your shoulder and your hip on one side closer together. And you just let your head go along with it. So I'm just trying to see if we can like trick our neck into going to the side by doing this position. And even if it's not tricked and you get to the ick zone, it's another place you can kind of work that. Okay, so that one can be pretty nice right there. You can also come into, like with your big toes together and your knees a little bit apart, you can come into a child's pose. Now, you want to be able to get your forehead to your hands. So if this isn't a good position, you can actually lie on your belly and put your forehead on your hands. And what we'll do is push your forehead gently into your hands. And then see if you can keep that push going and turn your head. So you're just gonna like roll along your forehead toward one side and roll along your forehead toward the other side. But the whole way we're just gonna try and actually push down. And if you're like, that's fine, Tiffany, but my hands are bony and that hurts, then you can get a little blanket or something like that to put down where you can push into the surface and then you just roll your head toward one side. And you just try to keep that nice, gentle but even pressure the whole time you're rolling side to side. Okay, that's when you can practice. All of these you don't have to do a lot of times. You can see I'm just doing a couple of times and then moving on. And you'll just want to do something a bunch of times throughout the day just to try and keep things moving along. Okay, last one that we're gonna play with. This one you can use a wall. You could also use like a tabletop desk of some kind. But for this one, we're gonna push hands into the wall. Keep really straight elbows. And then try to bring your chest closer to the wall, which is going to bring your shoulder blades closer together on your back. Then push the wall away, taking your shoulder blades apart from one another. So my elbows stay straight, but this is just another one of those little shoulder blade movements. And the next time you push your shoulder blades apart, you can walk back and lower down. We call this a wall dog. And you can do kind of whatever you want with your head. You can try to move it around in this position and see, you can let it hang. You can keep it even between your arms. And then you can come up and go back again. So I'm actually kind of getting your arms up over your head, stretching out your shoulders a little bit, things like that can be helpful with a neck crick. But again, you might get a little bit into the ick zone if it's sensitive to this position against gravity, but that's part of what we're trying to do, is make those muscles work a little bit against gravity. And then the last one is push your left hand into the wall, turn your torso like you're going to reach your right arm back, and you just see if your head wants to follow your hand. And you'll do that side to side. And so we're just using a twist in the body and then something for your eyeballs to follow to see if you can kind of trick your head into turning. And again, you might find you start to go and you're like, ick zone. And that's where you pause, take a breath in and out. Tell your neck it's okay and come back to center. And you can do more like that. Okay, those are some of the types of things that I'm gonna do if I get a crick in my neck. You'll notice pretty active. We're trying to get different relationships to gravity. We're just trying to move to whatever degree we can without freaking out when it doesn't quite work out. So take that time to breathe and soothe yourself and make sure that you're patient, because it can take several days to actually dissipate, and that is not an abnormal thing. So I hope that you don't get a crick in your neck, but if you do, I hope some of these tips help.